Hello everyone, this is Dr Sravanthi Sadu, fertility specialist from Kiran Infertility Center Private Limited. Today I want to discuss about fertility preservation in female. So the established techniques for fertility preservation in female are embryo cryopreservation, that is embryo freezing, and oocyte cryopreservation, that is egg freezing. So what are the indications for fertility preservation in female patients? Those women who are diagnosed to have diseases such as cancer and who do not yet undergone this chemotherapy or radiotherapy will be given an option to preserve fertility. And those women who want to postpone their motherhood because of being single or divorced and not yet find their partner, and who want to postpone their motherhood because of some personal, financial and medical reasons. And those women who are exposed to gonadotoxic drugs because of some hematological disorders such as thalassemia, sickle cell anemia, aplastic anemia is taken treatment for that. And those women who have surgical induced menopause because of repeated surgeries because of severe endometriosis and prophylactic oophorectomy or ovarian removal in case of BRCA1, BRCA2 mutation carriers. So all those women will be given an option to preserve fertility. And those women who have premature ovarian failure because of the chromosomal and genetic disorders like Turner syndrome, Fragile X syndrome, and because of autoimmune diseases, environmental factors. So all these women will be given an option to preserve fertility. So what are the criteria for selection of patient? So age is the most important thing. If the age is less than 40 years, then the woman will be given an option to preserve fertility. And the stage of the cancer, stage of the tumor, and the overall health status of the patient, and the time availability, the cost, and also the 5-year survival rate after the surgery or radiotherapy or chemotherapy, whatever it is. So basically it is a multidisciplinary approach involving the oncologists, reproductive endocrinologists, urologists, counselors, and reproductive surgeons who are experienced in fertility preservation techniques. So if the female is before puberty, that is pre-pubertal female, then the experimental technique, that is ovarian tissue cryopreservation, can be done. If the female is post-pubertal and if the time for stimulation is present, if there is ample of time for stimulation, then and if the male partner is present to give the sperm, then we can go for embryo cryopreservation. So this is the best method for preservation of in case of post-pubertal females, embryo cryopreservation. If the male partner is not available, then we can go for oocyte cryopreservation, that is egg freezing in post-pubertal females. If the time for stimulation is not present, then we can go for experimental technique, that is ovarian tissue cryopreservation or in vitro maturation. So the experimental techniques are ovarian transposition, ovarian suppression, and ovarian tissue cryopreservation. These are not routinely done methods. So hope in the coming near future these methods will be available. Thank you.